Hello, and welcome to day 4 of the mock trial. The trial is coming to an end, and today you will hear closing arguments from the plaintiff and defense. At the end of this video, you will see a link where we will ask you to submit your verdict on this case as our mock trial juror.
Ladies and gentlemen of the jury, on behalf of the plaintiffs, Mrs. Rachel Paulson, I would like to thank you for your time and effort in listening to all the testimony in this case. Obviously, a very important decision for you, a very important decision for Mrs. Paulson. We've heard from a lot of healthcare providers today during this trial about the care that was provided or not provided to Mr. Paulson. The main question for you today really boils down to one word, and one word only. Was the care provided to Mr. Paulson reasonable when he came to the emergency room? Was the care provided to Mr. Paulson when he was admitted to the hospital floor reasonable? Having listened to all this information, I think undoubtedly the answer to that question is no, it wasn't reasonable. Mr. Paulson came to the emergency room complaining of chest pain that he described as ripping, a classic sign of an aortic dissection. He was seen in the emergency room by Dr. Timmons. He was there for 9 hours. Dr. Timmons saw him once. From the time Dr. Timmons saw him around 1 in the afternoon until she formulated a care plan and sent him to the floor, she didn't go back to see him. His pain increased from 6 out of 10 to 10 out of 10, and he once again told the nursing staff who was looking in on him that his pain was ripping and it was uncontrollable. It was so uncontrollable. Mr. Paulson, generally a quiet, mild-mannered man, was loud. He was screaming for help. The staff just ignored him. They had, in the words of Dr. Timmons, all the information I needed. Dr. Timmons performed tests on Mr. Paulson. We don't dispute that. She did an EKG, an ultrasound, a chest x-ray. What she didn't do was the right test. Dr. Timmons told you she considered an aortic dissection, and she's agreed that the only way you can actually rule out an aortic dissection are performing one of two tests, a CTA and a TEE. All of the doctors, Dr. Timmons herself, and all of the experts have told you that these tests were available in the emergency room. They're not difficult to perform. They could have easily been performed. And had they been performed, they would have saved Mr. Paulson's life. Most important in going into, was Dr. Timmons' care reasonable? You need to look at that and ask yourself one thing. Was it reasonable for Dr. Timmons to create a care plan and transfer Mr. Paulson without reading the nursing notes? Dr. Timmons admitted to you that the information in those nursing notes would have been important. They would have been something she wanted to know. Of course it wasn't reasonable not to review the nursing notes. Why even have a nurse put notes in the chart if you're not going to bother to take the time to read it? Of course it wasn't reasonable. And because of that unreasonable omission by Dr. Timmons, Mr. Paulson's not here today. The errors don't end there. Dr. Timmons does admit Mr. Paulson to the hospital. There's still time to save his life. Dr. Jamie Miller, a trainee doctor, sees Mr. Paulson. Again, talking about information, the information available to him. This is not information in hindsight. You're going to hear a lot, oh, it was hindsight. The information available to Dr. Miller at the time was Mr. Paulson tells him, hey, I had a relative who was young like me that had an aortic dissection. So a family history of an aortic dissection at a young age. Two things that are classic risk factors for an aortic dissection. He tells Dr. Miller that. Dr. Miller has that information. He doesn't need to use hindsight to think about that. It was given to him in real time. But what does Dr. Miller do? He doesn't even put it in the chart. He simply cuts and pastes the exam that was done in the emergency room. So every other provider that sees Mr. Miller later in the day as his blood pressure's dropping, as he's becoming unwell, they don't have the benefit of knowing that he has this risk factor for aortic dissection, which all the providers have told you is an important thing and is important information that they believe erroneously helped them rule out aortic dissection because they simply ignored this information. Dr. Miller ignored a lot of information. He sat here and candidly told you, yeah, I received a text from the nurse, but it was too long. I didn't have the time to read it. That information was, hey, it's another cry from help from the nurse. It's, hey, Mr. Paulson's not doing well. His blood pressure's dropping. He looks unwell. Somebody come help him. Nurse Miller is concerned enough that she sends this text, but there's other doctors on the floor she can go to. She doesn't go to Dr. Miller personally. She doesn't go seek out a fellow or an attending. She sends a text and figures out that I've done my job. That's not reasonable. A reasonable nurse under those conditions would go find help. They wouldn't just send a text message which is just going to be ignored by the resident she sends it to. Finally, Mr. Paulson, as he's still decompensating, is seen by the attending physician, Dr. Kendrick. He's in pain. Dr. Kendrick sees him and doesn't ask him about his family history, doesn't know about the report of a family history of aortic dissection because providers failed to put it in the chart. He told you that had he known about that information, maybe he would have done something different. It would have been important for him to know, but he didn't. I think his words were, well, it may have prompted me to get a CTA. If only he knew that information. There was more information available to Dr. Kendrick that was available to him in the nursing notes had he chosen to read them. But once again, Dr. Kendrick tells you, I don't review nursing notes. If something's important, they'll come find me. I'm not going to bother to look at the nursing notes. Again, not reasonable. You'll hear that an aortic dissection is a rare occurrence and, oh, well, now we know in hindsight we can look at all this information, but we had tests and they were negative and we acted appropriately. No, you didn't. The providers know they didn't act appropriately. They ignored the patient. They ignored the information being given to them by the nurses. They didn't take the time to read text messages. They didn't take the time to look at the notes and the pertinent medical history that was provided to them. Unfortunately, Mr. Paulson's death is a death that could have been prevented had simply people taken the time, acted reasonably, and looked at all the information available to them at that time. It was there for them to see. They just chose not to look for it. You've heard a lot of testimony about the impact of Miss Paulson's, the death of Mr. Paulson on Miss Paulson, both financially and emotionally. You're going to have an opportunity to go back into that jury room and award damages to Mrs. Paulson for the violations of the standard of care that you're going to find were committed by these healthcare providers that ultimately caused Mr. Paulson's death. You've heard about the economic damages, and I would say you should award Mrs. Paulson every dollar of the economic damages that have been put on in this case. You've also heard about non-economic damages, both to Mr. Paulson at the time and to Mrs. Paulson for the loss of her husband. No amount of money is going to bring Mr. Paulson back. No amount of money is going to make it acceptable for what happened to Mr. Paulson. What I'd simply ask you to do is what these doctors didn't do. Act reasonably and give Ms. Paulson an award of reasonable amount of non-economic damages for her loss. Thank you.
Ladies and gentlemen, this is now my opportunity to speak to you. As I told you at the beginning of the case, I would be speaking to you at the close of the evidence to discuss with you what the evidence has demonstrated. And it's important that you understand the difference. At the beginning of the case, we told you what we thought the evidence would show. Now we're telling you what the evidence is. And that'll be for you to decide. You've heard lots of testimony, and you've seen medical records and exhibits, and it's up to you to determine the truth in this case. You know, I listened to my colleague, Mr. Fischel, make his closing remarks, and I stopped counting the number of times he used the word ignore or ignored. But that's not an accident by Mr. Fischel. There's a reason why the plaintiffs used the word ignored over and over and over again. And that's because if the plaintiffs can't prove that the healthcare providers in this case, my clients, the defendants, ignored Mr. Paulson, that's a problem for the plaintiffs. Because if Mr. Paulson wasn't in fact ignored, what you're left with is a really uncomfortable truth. And that uncomfortable truth is that bad things can happen to good people even when the people around them try to prevent it. And even when the people around them take all reasonable measures to try to prevent it, it can still happen. And it does happen. And it makes it hard to sleep at night knowing that your husband can go to the gym in the morning and be dead the next day. It's an uncomfortable truth, but it's a fact. Now, in this case, the summation of the evidence by the plaintiff is not entirely fair. And I want to give you two examples. You've been here a long time. You've heard a lot of evidence. It's not going to do any good for me to stand up here for too long telling you everything you've already heard. But I do think it requires me on behalf of my clients to point out a couple of things that I think are worth pointing out with respect to the testimony. The first instance is Dr. Timmons. Now, the plaintiffs would have you believe that Dr. Timmons made her assessment of Mr. Paulson's condition that afternoon based completely on records that were provided to her by the nurse or by other providers. But that's not true. In fact, the evidence is that Dr. Timmons examined Mr. Paulson herself and made an assessment of his condition herself. And in that instance, whether or not Mr. Paulson had reported ripping chest pain earlier in the day, the fact of the matter is he didn't report it to Dr. Timmons. And that's significant. And what do you know about that ripping chest pain? You know that it resolved. It had resolved by that time. And so it was a historical complaint at that time. And why is that important? Well, it's important because what you're evaluating and what you have to evaluate in this case is not whether Dr. Timmons was right in her assessment. It's whether or not she was reasonable. If the question were simply whether or not she was right in believing that the potential causes for Mr. Paulson's presenting conditions were gallbladder disease or an exercise injury, it appears she was mistaken about that because, in fact, Mr. Paulson had an aortic dissection. But that's not the question you have to answer. The question you have to answer is whether Dr. Timmons was reasonable in believing that the more likely explanation was one of the two other etiologies, gallbladder disease or an exercise-related injury. Now, the plaintiff says that Mr. Paulson was ignored by Dr. Timmons. In fact, the plaintiff says Mr. Paulson was ignored by everybody. But you have to ask yourself a couple of things about that. Number one, does it make any sense that a patient would be ignored? Does it make any sense that everybody involved in Mr. Paulson's care, not just one nurse, not just one doctor, but all four of the defendants in this case allegedly ignored Mr. Paulson? And you have to ask yourself, does that make any sense? Why would people who've devoted their entire adult lives to taking care of sick people then come to work one day and just decide to ignore Mr. Paulson? Well, the plaintiffs have suggested to you that maybe Mr. Paulson became agitated and he was a difficult patient. Well, I'd respectfully suggest to you that every patient who comes to the emergency department is agitated. They usually wait a long time, as Mr. Paulson did in this case. It's an uncomfortable situation for patients. They become increasingly frustrated with wait times, and they become increasingly frustrated as they become increasingly uncomfortable. There's no question about that. But that doesn't mean that providers ignore these patients. And in fact, what do you see from the evidence in this case? You see clearly that Mr. Paulson was not ignored. In fact, Dr. Timmons ordered 3 diagnostic exams to try to determine what was going on with Mr. Paulson. She ordered an ultrasound, she ordered an EKG, and she ordered a chest x-ray. Now, you've heard expert testimony that those were appropriate tests to order to try to get to the bottom of what was happening with Mr. Paulson, given his clinical presentation and the history that he himself reported. Remember, Mr. Paulson himself said, my chest pain has resolved, number 1, and number 2, I believe it was related to some spicy food that I ate. Nobody's blaming Mr. Paulson for not being proper in his own self-diagnosis, but the point I'm making is these things all go into assessing the reasonableness of the conclusions and the assessments reached by the medical providers. Now, the plaintiff's counsel said to you during his closing argument that those 3 tests weren't enough. And what did he say? I thought this was important. I wrote it down and I put quotes around it. And he said they didn't do the right test. Well, isn't it interesting that we almost always know the right test to perform when we know what it is we're looking for? So once you've read the last chapter of the book, all the other pages become clues. But healthcare providers, particularly those in emergency medicine, don't get to read the last chapter first. They only get to go chapter by chapter. And in this case, Mr. Fischel and the plaintiffs know very well that Mr. Paulson ended up with an aortic dissection. So it's easy to say they didn't order the right test, but you can only know the right test if you know what you're looking for. And Dr. Timmons didn't know what she was looking for. What she knew was that Mr. Paulson was uncomfortable and that Mr. Paulson had signs and symptoms that were consistent with many different potential causes. And she set upon an effort to determine which was the most likely. Now remember something I told you in opening statements, and that is the little secret that sometimes may be surprising to people to learn, that emergency departments and emergency medicine providers don't always know what's wrong with you. It's a process. And so the process involves diagnostic imaging, diagnostic tests, evaluations, history, and assessments and plans. And in this instance, all of that was done. What did the ultrasound reveal? It revealed the presence of something called sludge. And sludge is simply a mixture of solids. It's cholesterol and it's calcium. And interestingly, what you did not hear from the plaintiffs is that the primary symptoms for someone experiencing sludge are chest and back pain, nausea, and vomiting. Mr. Paulson had all of those. So before anybody gets away with suggesting to you how unreasonable Dr. Timmons' assessment and her potential or her conclusion that potentially what was causing Mr. Paulson's presentation was the presence of sludge and gallbladder disease, it's not so crazy as would be suggested to you. In fact, it's fairly consistent with Mr. Paulson's clinical presentation. But what else is important about that finding on behalf of, or that was made by Dr. Timmons? The plaintiff has made a big deal about the fact that Dr. Timmons did not read the nurse's note, which referred to the ripping chest pain earlier in the day. Again, we've talked about the fact that the ripping chest pain resolved. But maybe more importantly, Mr. Paulson didn't complain of ripping chest pain to Dr. Timmons when she did her own physical exam of him that afternoon. But what else is important about that? Here's what's critically important. Dr. Timmons testified to you that knowing that would not have made any difference because it wouldn't have changed her plan of care. She was going to admit Mr. Paulson for further observation anyway, precisely because she was not certain what was the cause of his clinical presentation. So you can make a big deal, if you like, about the fact that she didn't read the nurse's note. But the information conveyed in the nurse's note was nothing that she couldn't have learned from Mr. Paulson himself, And number two, it would not have changed her plan, which was to admit him for further observation and evaluation and workup to determine what was the cause of his presentation. You had the opportunity to observe Dr. Timmons yourself. And so you don't need me to characterize for you how she presented. That's for you to determine. But I will say this. It's hard to imagine someone with Dr. Timmons' education, Dr. Timmons' commitment, Dr. Timmons' skill, knowledge, training, and experience acting as unreasonably as the plaintiffs have suggested to you that she did. She has dedicated her life to caring for people in an emergency medicine setting. And for what it's worth, her testimony to you and her explanations to you of the care she provided to Mr. Paulson was eminently reasonable. It may not have been right. In fact, it wasn't. But that doesn't make it unreasonable. And the law says what you're here to determine is whether she acted reasonably, not whether she got it right. And why, by the way, does the law say that? Well, the law says that because we can't always be right. I can't be right in my profession all the time. Doctors can't be right in their professions all the time. Nobody can be correct all the time. That's why the law recognizes that that's not the standard. The law recognizes that the standard is reasonableness. And Dr. Timmons acted reasonably. I want to tell you, I told you there were two examples I wanted to highlight for you about, I think, unfair characterizations of the actions of the healthcare providers. The other one is Jamie Miller, Dr. Miller. Now, again, we hear over and over the word ignored. And the plaintiff will tell you that Dr. Miller ignored the nurse's tiger text message. But that's just, in fact, not true, and you know it's not true. How do you know it's not true? Because the tiger text message response from Dr. Miller says, I'm going to order Dilaudid, and then I'll be there to check on the patient. But the plaintiff has repeatedly told you that the text message was ignored by Dr. Miller. Why would they tell you that when it's not true? The reason is, as we've already discussed, because they must find a villain. They must create a scenario where the patient is ignored. But that's not what happened. Dr. Miller responded to the text message, so we know she read it. Now, here's maybe the most unfair thing that's happened in this case. It's been portrayed to you that Dr. Miller simply couldn't be bothered to read the text message. And as I've already explained to you, and as I've already clearly demonstrated by the evidence, she did read it. But what has nobody told you? Well, what Dr. Miller herself told you, but the plaintiff certainly didn't tell you this. Dr. Miller read the tiger text while she was in the middle of a code, trying to save a patient's life. So it is certainly true, and by her own admission, she wishes she had read it more thoroughly. But the question is whether she acted reasonably under the circumstances in reading it quickly and cursorily, trying to get the gist of the message while still trying to save another patient's life. You see, that's the difference between evaluating the evidence here in the courtroom versus evaluating the evidence as it was received by the healthcare providers in real time. There's maybe no better example of it. Dr. Miller was fully involved in a code response trying to save a patient when she read the text message. And I suspect to you, nobody wishes she had read it more carefully, but that's not the question you have to answer. The question you have to answer was, did she act reasonably? And she did. She prescribed medication and she said she would be there to see the patient shortly. You say, well, okay, but that's not fair to the plaintiff, that's not fair to Dr. Miller or to Dr. Timmons, right? Well, it's not fair, but one thing to remember is that the plaintiff did not promise to treat the healthcare providers fairly. They never made any such promise to treat Dr. Timmons fairly, to treat her testimony fairly, to treat her care fairly. They didn't make a promise to treat Dr. Miller fairly. That's why they've told you Dr. Miller ignored the text message when in fact the objective evidence is that she did not. They didn't take an oath to treat any of my clients fairly. But you did. You did. You promised at the outset of this case that you would base your verdict in this case on the evidence presented. And that requires you to evaluate that evidence fairly. This is a sad story, and sad stories deserve our attention. Mrs. Polson deserves our attention. Mrs. Polson deserves our sympathy, and she deserves our support. It's okay for you to be sympathetic. It's okay for sympathy to be part of what you feel in this case. But it is not okay for sympathy to be part of what you think. That's the oath you took. That's the promise you made when you raised your right hand and were sworn as a juror. You decided you would evaluate this case based on the evidence. And the evidence in this case supports the conclusion that while not correct, the healthcare providers acted reasonably in believing that the more likely cause of Mr. Polson's presentation was something other than an aortic dissection. And because they acted reasonably, your verdict must be in favor of the defendants. Thank you.
Ladies and gentlemen of the jury, I thank you for your diligent attention and careful consideration throughout this trial. Your role is vital in ensuring that justice is served, particularly in cases as complex and significant as this one, involving allegations of medical malpractice. As you prepare to deliberate, I must remind you of your responsibility to weigh the evidence presented objectively and without bias. Your decision should be based solely on the facts as they have been established in this courtroom and the law as I have instructed you. Remember that the burden of proof rests with the plaintiff to demonstrate by a preponderance of the evidence that the defendant failed to meet the standard of care expected of a reasonable medical professional, and that this failure directly resulted in harm to the plaintiff. Consider each witness's testimony and the exhibits admitted into evidence. It is important to recognize that not all medical outcomes that are less than ideal constitute malpractice. Medicine is not an exact science, and even the most skilled practitioners can encounter unexpected complications or unfavorable results despite their best efforts. Ultimately, your task is to render a fair and just verdict based upon the evidence and the law. Your decision will have a profound impact on the lives of the parties involved, and I trust you will approach your decision with the seriousness and integrity that it deserves. I commend you for your service to our system of justice and trust in your ability to fulfill your duty with wisdom and impartiality. You may now retire to deliberate, and when you have reached a unanimous verdict or a decision upon which you all agree, you may return to the courtroom to deliver it. Thank you.
Hi, everybody. So has anyone ever deliberated on a jury before?
I've had jury duty a few times, but I've never made it this far. This was my first time on jury duty. Not me, but I've watched a lot of legal TV shows, so Suits is my favorite. Has anyone seen it?
No, but I did take a lot of notes we can go over.
I haven't been on one, but I think we should take a vote and see where we are with this.
That sounds like a good idea. Is everyone okay with that?
I saw this episode on Law and Order where they got to visit the crime scene.
That's because it was a criminal case. This is a medical malpractice case. They don't do that in this type of case.
Okay, well then let's take a vote. Who thinks the doctors did something wrong? Raise your hand. Who thinks that the healthcare providers didn't do anything wrong? Raise your hand.
It's so obvious that they treated this guy awful, and I think that they should be found guilty just because of that. This patient came in and he was in pain, and they totally ignored it. It's almost like they thought that he was making it up.
They may not have treated him well, but that doesn't mean there was negligence. They did order tests and they did examine him.
Yeah, but they didn't order the right test.
I say we take another vote, see where we are with this. The hospital has a lot of money. They have a big bank account. This isn't going to hurt them.
Okay, why don't we talk about the people who testified?
What did people think about the experts?
They make a lot of money doing this, so they'll say whatever they want them to say.
But I don't think they'll lie.
Okay, time out. Let's go in order of who testified. First, the wife. Let's talk about her.
Did you guys see the wife crying when they said that he could have been saved? She's
Yes.
so sad.
But we have to keep emotions out of it.
Yeah, but that can be really hard to do. Someone died.
Okay, yes, I think we can all agree it's very sad, but let's talk about the next person who testified. That was the internal medicine resident.
Is a resident even really a doctor?
Yes, they are. A resident is a doctor.
She was great. Not. All she did was blame the nurse.
Oh yeah, she was the one who kept talking about like the cutting and the pasting of the notes. She never even put anything new in the medical record. She just copied and pasted. Copy and pasted. Copy and pasted.
What about the nurse?
I felt bad for her. She was just trying to do the best for the patient.
Yeah, I liked her too. She seemed to really care about the patient.
She sent a tiger message to the doctor.
What's a tiger message? It's like texting.
Okay, anyone else? Or let's move on to the floor attending. What do people think about that doctor?
Yeah, let's talk about him, Mr. I don't read nursing notes. He didn't even know that the patient had a family history of aortic dissection. Seems like negligence to me.
Yeah, just like they show the pin. The doctor always says they're too busy taking care of patients to read notes.
But he clearly knows what he was doing. I mean, this event happened 2 or 3 years ago. How are they supposed to remember anything?
That's why they should document the medical record.
Why are we doing this? Just give them some money and everyone can move on with their life.
Okay, what about the emergency room expert for the plaintiff? What did we think about that person?
Was she the one with the brown hair and the colorful shirt?
Yes.
I don't know what the rest of me think, but all the medical talk was confusing to me. I'm not even sure what they were saying.
Well, what do we think about her testimony?
I thought she was good. Sounds like all they needed to do was order a CTA and they would have been able to identify the aortic dissection and then the patient would have gone to surgery.
I believe her, and if I believe her, then the doctor messed up. All done. What are we going to give them?
I just wonder how they figured out what ripping chest pain for one patient is compared to another patient.
She explained it well. Well, ripping chest pain means an aortic dissection.
You all make it sound so easy. These doctors see hundreds of patients. They have to make decisions every second to figure out what is going on with their patients.
Yeah, I mean, they would have had to do major surgery on this guy and he may not have even survived it. It sounds very complicated. Let's move on and talk about the emergency room doctor who was there and actually treated the patient.
Well, she was actually the one I really wanted to hear from. I think she was the most important person in this case. She was there at the time.
I thought she knew what she was doing and was thinking about all the things it could possibly be. However, she did say she did not read the nurse's note. That's a little concerning, especially when the nurse is with the patient more than the doctor is.
Yeah, but the doctors have a lot of patients to see, and she seemed like she cared about the patient. She came across as sincere. I would want her to take care of me.
She didn't even look at the wife when she was testifying.
Give her a break. I'm sure she's upset by all of this too.
Anyone else have any thoughts on the emergency room doctor? No. Okay, the last person to testify was the heart surgeon.
The cardiothoracic surgeon?
I can't even pronounce that big word.
She seemed really smart. I think you have to be in order to do what she does.
Well, she did say that if a patient reports ripping chest pain, then you have to think aortic dissection. I mean, their own expert was the one who said it.
She did, but she also said that you have to look at the other risk factors. The patient didn't have any risk factors. He presented with back pain. I'm sure they see hundreds of patients with back pain. They admitted him to monitor him, not like they threw him out. She has a lot of experience.
Okay, well, that's all of the people that testified. Does anyone else have anything they want to say? Okay, well then let's take another vote. Now that you have heard this case, we are asking you, as our mock trial jurors, to submit your verdict using this link. Obviously, you won't be formally deliberating as a group, so please share your decision about the trial. We will reveal the jury conclusion that comes from you on Friday, June 20th during your hospital safety huddle. Please use the link below this video to submit your vote. Tomorrow, you will hear the mock trial jury's verdict. You will hear from a jury consultant, and you will learn more about the support that MMCIP offers if you are involved in a medical malpractice lawsuit.